This time in our country's history is truly unprecedented, and stress levels are going up for many folks, and it's important for all of us to remember to monitor our heart health. And Dr. Shoba joins us this morning to discuss heart health during this pandemic. Dr. Shoba, thank you for taking some time with us today.
Good morning. Good to be here.
All right, let's start off talking about the elephant in the room, COVID-19. There's so many things going on there. There's a whole spectrum of illnesses and infections also going around right now. What should you keep in mind heart health wise when you're thinking about maybe getting tested or things of that nature?
You know, just like any other infections, including COVID-19, I'm sure that there is a huge spectrum for any illness that we have. There are people who are asymptomatic, hardly have any symptoms. Then there are people who have moderate amount of symptoms. Some people who are extremely symptomatic end up on breathing machines, and some people, could die at the end of it. And in people who are asymptomatic or less symptoms, they may not even know they have the disease. And this is not true for infections. This is true for all illnesses in general. There's a huge spectrum in way people present with symptoms.
And what the role of infection and your heart health and heart attacks, there is a role there that there is a correlation between infection and heart attacks, aren't there?
Unfortunately, there is. Over many years, we have found that when people have infections, they have flu, we find that they have more heart attacks. And there are some theories behind it. It's almost like these infections cause a stress test to your heart. There are extreme amount of stress. Forget the emotional stress. There is actually a component that actually can cause heart damage. We have seen EKG changes. We have seen heart enzymes leak. These are called troponin. But sometimes when we do heart catheterizations, we do not find much blockages. On the flip side, people may have asymptomatic heart disease. They don't even know they have heart disease. And when they get this infection, they present with a big old heart attack. The artery is completely blocked. They have permanent heart damage. In some people, the infections will directly affect the heart muscle or the lining of the heart, like myocarditis, pericarditis, valve infections. And there are some theories floating around behind it. What these infections do is cause inflammation. Inflammation is something that can cause any cholesterol plaque to rupture, and clots can form. And unfortunately, the body may not have the ability to dissolve these clots quickly, and they can damage all your small capillaries and cause permanent damage. And so it's very important to take care of your heart in these unprecedented times, as you said, because not only are many people in our Tri-Cities area at risk for heart disease to start with, and then on top of it, you get infections, and we do not know clinical course, what happens with time. It's a learning process for everybody.
What are some things we need to keep in mind, especially considering a lot of people are on medications, especially heart medications, high blood pressure medications? What are some of the things we need to keep in mind while we're going through the pandemic?
Correct. There are some blood pressure medications that have, these are ACE inhibitors, angiotensin receptor blockers, and there are some questions, that have been posted in different places around this. And what we are telling our patients is, if you've been stable on this medication for a long time, then there's no reason to abruptly stop it. In fact, if you stop blood pressure medications and your blood pressure goes very high, you're at risk for heart attacks and strokes. Some of the other medications that we have to be careful of, with the COVID-specific medications that are also there, we have to be careful as well. There are some studies coming out regarding, heart rhythm issues, and our hospitals and our local doctors are doing their best to identify people who these medications are safe and need to be given to. We have known this for a long time. Patients who take medications for depression, antibiotics like azithromycin, hydroxychloroquine, all of these medications can prolong something called QT interval on the EKG. And those people in whom this QT interval could be prolonged, could they be the people that are more at risk for rhythm problems? Again, a lot of studies going on. Very important that you talk with your cardiologist, with your primary care provider. And a little word on vitamins as well. Vitamins are good. Antioxidants, all kinds of vegetables with different colors, different fruits, they give you a lot of antioxidants. A lot of medications and elements out there that are touted to help with your immune system, and that is true. Natural products like ginger, garlic, all these things have been touted, and all that is very good and normal. But when you start taking supplements that are not regulated and take them in large volumes, be careful what you're actually taking into your body. Read the label clearly to see what exactly you're taking, because these may not be regulated, and excess of any chemical could be bad for you.
All right. Dr. Shoba, thank you so much for taking some time with us today. Great advice, great things that we need to keep in mind while going through the stresses of hunkering down during the pandemic. Thank you so much.
Thank you very much.
All right, Dr. Shoba there. Folks, we got information for you right here. If you've got questions, you can go to the American Heart Association website. We've got the information on the website right there on the screen.